Eddie Boone's scars tell his story.
This is the newest one.
They show he's no stranger to the operating room, joints that have needed repair over his 76 years. But this latest scar on his left shoulder marks history.
I feel good. My range of motion is good. It gets better every day.
That scar is the only evidence of his latest surgery, a reverse shoulder replacement. No sling, no brace, swinging his arm from head to hip.
So you can see I'm just taking that burr and rubbing it over it and just taking little by little pieces.
A far cry from 2019, when Eddie couldn't lift his arm to saddle his horse. He knew then something wasn't right.
Because it's been just useless, basically. When you can't pick up much of anything, I don't know, pretty much just disabled with it. Couldn't drive, couldn't eat with my left hand. You couldn't steer the steering wheel, clothe yourself, socks, shoes. It's crazy.
Years of conservative treatment led him to Dr. Justin Givens at Norton Orthopedic Institute. The diagnosis, an unrepairable rotator cuff tear and severe arthritis.
And so you have really two problems going on that the reverse shoulder replacement was specifically made for. And then you say, okay, but is it affecting his life? He can't lift his arm, he's in terrible pain, he can't sleep at night. So for me, that's someone that, one, has a problem we have a fix for, but two, has a problem that's significantly affecting their life.
So in he went. 45 minutes for Dr. Givens to perform the reverse shoulder replacement, but with a twist. Surgery done with the help of this new, groundbreaking robotic arm. The robot and the 3D technology it's attached to gave Dr. Givens a virtual blueprint of Eddie's shoulder, helping him shave down the patient's glenoid or socket to create the picture-perfect surface for the custom shoulder implant. The goal? Unmatched accuracy and faster recovery.
I make my scan, I'm within 0.1 millimeters of accuracy, I'm within 0.1 degrees of accuracy as far as my angles that I'm using, and that's something we never had in the shoulder before. So that gives me ways that now I can try to give you just a little bit more. Instead of just trying to make something that kind of works, I can move things millimeter by millimeter to try to give you the most optimal function possible.
Precise and historic, because in March 2025, Dr. Givens became the first surgeon in Kentucky and among the first 5 in the country to perform this robotic-assisted procedure, pushing the boundaries of orthopedic technology to places it's never been.
Now the things that we've theorized we can do to make you more functional, we can actually put to the test. Does it immediately mean we know it's going to be 100% better? No, actually. And that's the whole point of being at the forefront of innovation. Our goal is that we take these things that we've been thinking about for 10, 15 years and apply them and try to see how much better we can make you.
And so far, so good for Eddie. Out of a sling in a week, doing this in just 3, reminded of what was in his past.
The post actually goes into the bone right here. And so that's about the cut where that is.
And looking forward to what's in his future, thanks to a futuristic approach to shoulder surgery.